without further ado, please welcome to the stage, Helen Gowers.
So it was an opportunity to scale up the low carb groups that PHC ambassadors have been running for many years. And we worked with another charity, Expert Health, who have years of experience delivering structured education programs. So we've got a fantastic course, fantastic handbook that the participants absolutely love. And so far, we're in 10 locations around the country. We've had 56 surgeries now signposting their patients to our service. And we've had over 1,300 participants go through our course. Last year we were Kismet accredited, and that just shows that we're a really quality structured education program, but also that surgeries referring their patients to us are able to get their quality outcome framework targets. So there's an added incentive for them as well. And hopefully you can see that. Those are the comments that Graham Baker gave us last year when he gave us that certificate. Really just to show that they went through everything with a really fine-tooth comb, and they were very impressed with what they found. I wanted to introduce you to my fantastic team. To be honest, this is really the engine behind TLC. Sarah, our administrator, joined about a year ago, and she does all of the enrolments. She really keeps the whole show on the road. And in fact, she's out there at the moment welcoming people to the conference. John has trained with Expert to become our training manager. And so last year we ran our first in-house training program to be able to educate our own health coaches. And David is now our quality assurance assessor. So he's checking that all of the coaches are meeting the learning points that they need to, and to maintain the standards of delivery. And all of the coaches are offering sessions through the week and at different times of the day. So we run classes in the morning, in the afternoon, and in the evenings, so that participants can always find a session that's going to suit their availability. And really, I just can't thank them enough. They are so dedicated. They're really passionate about real food. They all started off as PHC ambassadors, and they just have such practical knowledge of the low carbohydrate diet that they're really able to get stuck in helping people to solve solutions as to how they're going to make this work for them. And yeah, just their dedication, their enthusiasm, and just the time that they give to the service is really appreciated by me and by our participants as well. So in terms of referring, once a surgery has signed up, then they literally just signpost their patients to our booking website, where they'll be able to sign up for a TLC information session. And a health coach will talk them through all about the course, what the advantages are for low carb, and how to enroll. And we find that over 80% of people that come on one of those information sessions sign up. The course itself is 8 weekly sessions, and each session is an hour and a half long. So it's plenty of time to go through how people have got on the previous week, talk about the topic of the day, and then there's a bit of goal setting towards the end of the session so that people are really focused and know what they're going to be working on over the week ahead. It's a group session, and we have up to 12 people in a group. So it's a really nice size for people to be able to discuss, share ideas, see how somebody else is approaching something. And often the participants are helping each other, and the coach is really just facilitating the process. All our sessions are delivered over Teams or Zoom, and this works really well because it means that people with mobility issues or transport trouble, people who've got children that they need to supervise, we have 2 people teamsing in from work, from their holiday, and I think that's one of the things that really raises our attendance level. So we have fantastic attendance through the course. So most people will go on to our lifetime support program, and right at the beginning we realised that this is something that these people need to keep going with for life. So it was no good just delivering an 8-week course and then sort of saying, well, bye, you're on your own now. So we have monthly catch-up sessions where we'll have a guest speaker, And those are really well attended. We get at least 60 people coming to those each month. We've got a really active Facebook group. We have a WhatsApp community that have different discussions on fasting, on well-being, or on exercise. And we're also encouraging the participants to get to know the other people in their local areas. So we're setting up local support hubs, because obviously the course is online, they'll be meeting people from all over the country, but then we're introducing them to the people in their communities. That was just to remind me to say that for clinicians, we do a lot of extra support. We've got a members website, so you can find about sort of programs to help you support patients with low carb, prescribing. It's all a bit in and out, isn't it? Notes on deprescribing, we've got all the latest research papers on there. And also clinicians and participants can live stream this conference for free each year. So lots going on. Our results are really promising. So at 6 months, we're able to show 6 kilograms of weight loss, waist reduction of 10 centimetres, HbA1c coming down by about 10 millimole. And actually that's across the board. But if we just look at the type 2 diabetics, it comes down by minus 12 millimole. So really, really good results. And often that's when people are reducing medication at the same time. So lots of people are able to reduce medication or come off it completely. Empowerment goes up. People just say that they feel so much more confident to go off and join a gym or to do something. I had somebody go back to their singing, that they really enjoy doing choral singing. But also just their confidence with their diabetes and how to manage it and what they can do to help things for the future. In terms of how to pay for it, we're able to use the additional roles reimbursement scheme. So the GP surgeries are able to claim back the cost of the programme. So it's a really economical way, particularly of using up underspend with their Rs funding. And at £150 per person, it's a really cheap programme compared to some of the other ones that are available. So now you can clap. We were so excited. So we entered this award. It's sort of like the Oscars of the NHS, and I'm working with Conor Burke, who's been helping me with the business side of TLC, and he said, oh, well, you won't win anything because it's massive and you'll be up against all sorts of really important other groups. But we entered it. We actually were shortlisted in 3 categories, and then we ended up getting the silver award for primary care projects. So already doors are opening. People are now starting to listen to what we're doing. And hopefully that's going to be really helpful for the future. This is where we are in the country, so we are dotted around quite nicely at the moment. And really the plan is to try and find an ICB or an ICS to partner with us so we can demonstrate whether this approach is going to work at scale, and perhaps also look at health inequalities, how we can do more for that. But it's going to take time to find an integrated board that will be able to help us. And also I think finding funding for that's going to be quite challenging. So really my plea for this year is to help us to grow TLC organically. We need to reach out to our networks within public health collaboration and TLC. And so anybody that's new and heard about TLC for the first time today, please do get in touch. The health coaches are all wearing their orange shirts, so go and talk to one of them, go to our stand that we've got in the exhibits hall, but do try and find out how we can help you to help your patients. Also, we're trying to think about how can we grow what we've got already to neighbouring PCNs. In Guildford, I'm now talking to Leatherhead as potential, and then also Trafford, I think, might be interested up in near Manchester. And then really to the low-carb practitioners out there, and I know that there's a lot of you, I just wondered if we can extend what you're doing in your surgeries to the rest of your PCN. So if you'd like to use TLC to do that, I've got a little case study for you, and Ruth has very kindly allowed me to use her as an example. So I don't know where Ruth is, but Dr. Ruth Tapsell saw my presentation last year, went away and got her clinical director team to agree to a trial of TLC. So they were able to utilise the underspend of their Rs funding and just basically stretch out low carb to the rest of the surgeries in the group. We had 95 patients have gone through, and actually it was all managed by the PCN administrators in that they literally just sent out 800 text messages to eligible patients. And almost overnight, we had 90 people responded. So over 2 months, they went through the course, and we had fantastic attendance, over 70% attending 7 or 8 of the 8 sessions. And then the results actually reflect very closely to what we're getting with TLC overall. So weight, almost 6 kilograms, exactly the same. HbA1c 9.6, and blood pressure as well, we were monitoring, so that all came down. So yeah, please do have a think about it. We've set up a Torridge local support hub, and they're meeting regularly just for coffee, sharing recipes, going for walks. And this is very similar to the hubs that we've set up around the other locations in the country. So final thing is just to update you on our research study, which I was crowdfunding for last year. We started it in January. We've now had 55 participants have had all their baseline measurements taken, and they're working their way through the course. I think the first cohort has actually finished their course now. And we've got 8 surgeries in Guildford that are sending their patients to us for that. The outcomes that we're interested in is really the engagement and who's going to do well on TLC. I think the interesting question. HbA1c, weight, and then obviously medication changes we're measuring. And at the moment we're doing 3 months and 6 months, but we hopefully will just get a bit more money. We need another £13,000 to be able to do a 2-year follow-up, which is obviously the one that everyone's interested to hear. So if you fancy donating, then yeah, please do look up our crowdfunding website and perhaps donate a little bit towards that. So hopefully you'll think of a way to support TLC, and please do send us your patients. Thank you.